You're live.
Hi guys, it's Danielle with Dr. Emer's office. So we're finishing the day with, we did a facial and now Clear and Brilliant. And so we really just want to get a little bit of a skin refresh for our patient. He's been breaking out, traveling a lot, and his skin is reacting. So what we did today was started in this area right here. In this one little quadrant, you can see that he's just developing a little bit of redness. You can kind of see some of the texture from the roller, but not too much. This is what we can more or less expect from the treatment. You can see where I finished. So I'm just going to continue. You can see here, just to show you the technology really quickly, it is a roller, and every time these little points hit the skin, you're releasing some energy, and that is going to cause some cell turnover in the area, stimulate collagen. It's great for acne. And this handpiece in particular is going to work a little bit better for texture and acne than the Permea handpiece. The Permea handpiece, which we can change out to, is safe for all skin types and really very based on skin concern. So for today, for acne, for pores, for lines and texture, it's the original handpiece. And this is a treatment where you're going to use it sort of as maintenance. Each one is going to leave your skin feeling great, but it pairs well with other treatments, whether it's a facial or another laser, something like a vascular laser, or even just standalone. But to get the best results from something like Clear and Brilliant, because it is very gentle, you'll want to do multiple. So a series is always going to be best for this. Feel okay? Mm-hmm. Okay. So with this laser, we apply several passes to the skin. The more passes we do, the more coverage on the skin, and ultimately, the stronger the effect of the laser is going to be. So we're going to continue a few more passes here and then move on to the next area. Are there any questions about Clear and Brilliant?
Yeah, how long does this redness last?
So the redness typically lasts about 1 to 3 days. Go ahead and turn your head to the side. It depends on the patient, but it doesn't persist for very long. The day of treatment, so kind of what you would expect. As far as Clear and Brilliant goes, this original handpiece is safe for lighter skin types. So anything like a 3 and lighter is good for the original handpiece. Great for lines, great for pores, great for acne. This handpiece, or both the handpieces, the Clear and Brilliant in general, is a little bit prickly feeling. So we numb the skin topically. After the numbing, you have your treatment done. After the treatment, you're red and warm for that evening, and then you have a slight pink color to the skin that lasts for up to 3 days, and a little bit of a sandy texture. And over those few days, the sandy texture flakes away. You don't need to pick at it. You don't need to exfoliate it. It just comes off as you wash your face and apply your skin products. And that's really it. You instantly have a nice little glow, and your skin looks a little bit better overall. But it doesn't have, this is not something that has downtime. Any tinted sunscreen or makeup can cover this. That sandy texture that I'm talking about is not visible to other people. You just can feel it on your own skin. So it's a great no downtime treatment for a lot of different skincare concerns. And like I had mentioned, the Permea handpiece is safe for all skin types. So you can use that even on darker skin types, whether you're looking for anti-aging or brightening of your skin or to improve pigmentation. So a lot of versatility in this treatment. Definitely good that it has no downtime. What else do we want to know? Any other questions?
How does this affect acne scarring?
Well, acne scarring, it's kind of a broad term. So you can have pigmented acne scars, you can have depressed scarring, you can have hypertrophic scarring. All these different types of acne scars or scars period require different types of treatment. So the way that a treatment like Clear and Brilliant would help is that you can use the Permea handpiece to improve the pigmentation or the dark spots that get response to inflammation, heat, trauma with melanin or the pigment cells in your skin. So that's how we get those little dark spots, whether they're brown or pinkish in color. And the Permea Clear and Brilliant handpiece actually works very well on that. Go ahead and turn this way. Other acne scars are a little bit thicker in texture, so having a treatment that gives you some resurfacing, collagen stimulation, and cell turnover will actually help to break down some of that thickened scar tissue and smoothen out the surface of the skin. So those are 2 ways in which this treatment can help. The only thing when it comes to acne scars or any scars is that they can be very stubborn. So this is a very good adjunct into our treatment plans, but we also want to combine this with stronger treatments that will actually break down the scar tissue. Things that include like microneedling or microneedling with radio frequency is very good for those thick, deep scars. And also other treatments that have a little bit more direct or quick resurfacing properties like an erbium are also very helpful. So it really depends on the patient, their schedule, the downtime, and what the preference is. Oh, and of course what the condition's like. So a lot of versatility.
And can you use this on the neck as well?
Absolutely. You can use this on any part of the body. We have a few very unique treatments that we use this for. A lot of different concerns, whether they've been hyper or hypopigmentation. There's a lot of things that we've been able to kind of combine to get some really incredible improvement from this treatment. Whether you have kind of scarring or any textural issues on your face, your neck, your back, the body, this is a good treatment for it. Any skin, any area.
Do you need a consultation to get this? And if so, how?
We absolutely recommend having a consultation. Every patient who comes to our practice or calls in for a consult speaks with myself, one of our consultants, or with Dr. Emer. And the reason that's so important is because everyone's skin is unique, and dermatology is definitely a visual specialty, and pictures and phone calls just don't do it enough justice. So being able to be seen, if possible, is great. If not, photos work very well, and we really get very in-depth discussing what would be the best route for our patients. So we do want to have a consult because it's not a one-size-fits-all when it comes to skin and unique concerns. So we come up with not only a short-term but a long-term plan, and it's kind of all-encompassing everything. Doing okay? Everything from what you can do at home to things that we do in the office, whether it's laser, threads, injectables, peels, you name it. So consults are definitely required. And they're a very important part of patient education. Even myself as someone who has been in the industry for a long time and knows skin and knows lasers and knows what these can do for you. Even sometimes with myself I get confused and I have all these options of great skincare products, and it's kind of complicated to know where to begin or what to layer. So we guide you through that, whether it's myself, Dr. Emer, or skincare specialists, estheticians. We all work at it together. So come on in for a consult. We would love to help you with that. What else? Or should we stay on the skincare topic?
Well, someone's asking about retinoids, and do you have any good advice about them?
That requires a pretty long talk, but retinols are absolutely important. There's different strengths, different types, and they're great for acne, great for anti-aging. I always tell people if there were two products that if I could only choose two, the two things I wouldn't live without are retinol and sunscreen. So that's a brief explanation on that. You feeling okay?
Mm-hmm.
Doing awesome. So at this point in our treatment, we have very cohesive redness. Skin is getting a little bit warm. The treatment's feeling a little bit more prickly. But this is about what you could expect. So there's some heat in the skin. It's going to persist for a couple hours after treatment. At least with myself, I feel like it lasts a little bit. So let's talk about we talked about how you prepare in terms of you can prepare with a facial, you prepare with a little bit of numbing. We have our treatment, we get nice and red, we build up some heat in the skin. What's important after treatment, and every office, every provider is going to do this a little bit differently, but what we do that's unique is we cool the skin down right away. And by taking the heat out of the skin, we really do cut down on redness, cut down on downtime, and it's going to feel much, much better. So a nice cold mask is going on the skin after this. We may apply some serums to infuse, whether it's vitamin C or hyaluronic acid or B5. And the skin's going to drink those up. It's going to get its nice little bit of hydration. And then he has already spoken with our skincare specialist, and we've discussed at this point what would be helpful to help him heal from this treatment, and then what would be good for his skin to prevent the acne going forward, and what sort of regimen is ideal to maintain or improve and maintain a better, more even skin tone. So we are going to kind of discuss that a little bit more in detail later. But our skincare definitely includes growth factors, vitamin C, some hydrating serums. How are you feeling? You want to keep going a few more classes?
Go one more.
Okay, good. It's a trooper. So we use all these products to heal the skin, nourish the skin. The only thing that we're missing here, and it's a cherry on top, is PRP. So platelet-rich plasma. And it's great because it takes all the healing factors, all the growth factors out of your blood. You get rid of the red blood cells. We don't need those. We take that yellow serum that comes out of our blood. It's the same serum that comes up when you scrape your knee. You're not quite bleeding, but your body's registering that it needs to promote healing. We take that from the blood. We've spun it. We take out that yellow serum. It has about this type of a treatment frequently. So by applying the growth factors, we improve downtime by about 40%. So for more aggressive lasers, instead of having a week of downtime, you might only have 3 or 4 days. So that's great. And it's good for brightening. It's good for anti-aging. It's good topically. It's great when you inject it. I like to use it for dark under eyes. So that's another thing that we use as a step in terms of maximizing our treatment and giving our skin everything it needs to heal. Past to his beard, we discussed earlier what type of products would be beneficial because men tend to kind of like little whiteheads, oil accumulation around the hairs in the beard. It's thick hair, there's a lot of oil glands here, and using ingredients like retinols or actives and exfoliants will help to take away any debris. There we go, we finished our treatment. Take away any oil, dirt, and debris from this area so that you don't actually get, I'm gonna give you a second, okay? You don't get these little acne lesions in the beard area. So a treatment like this will actually help to exfoliate any accumulation of dead skin cells around the hair follicle, which is contributing to that folliculitis and irritation. So yes, you can treat over the beard. Yes, it would help it. Any resurfacing is great, and of course adding in good skincare and exfoliants will be better. So the next step here, and we can tune back in for it, we're gonna put a nice cold sheet mask on his skin. It's nice and red. You can see the color difference. Go ahead and turn your head to the side. You can see the color difference from the untreated to the treated area. And it's going to cool him down, take out some of the redness, and then we'll be applying some good skincare. So thank you for checking in. If you have any other questions I didn't get to, just go ahead and send them in to us on a DM, and I'll answer.